With hospitalizations increasing across the country, Dr. Chansom's experience is becoming a horrifying norm. Medical professionals need help and cooperation from all of us right now. As The Atlantic's Ed Yong puts it, after interviewing medical professionals across the country, in the imminent future, patients will start to die because there are simply not enough people to care for them. Doctors and nurses will burn out. The most precious resource in the U.S. healthcare system has in its struggle against COVID-19 isn't some miracle drug. It's the expertise of its healthcare workers, and they are exhausted. Joining me now, Ed Yong, staff writer at The Atlantic covering science. Ed, good to see you. Thank you for being with us tonight. What's the big takeaway for you when you've talked to these health professionals, other than their remarkable dedication, other than the fact that they don't work from home, they expose themselves and their families to coronavirus to do this? But what did you learn?
They are exhausted. And that word almost doesn't do justice to what they're feeling. Many of them are working 12, 24, 36-hour shifts. They are dealing with patients dying on them at a ridiculous and growing rate. A lot of them are working in emergency rooms and ICUs that are full. COVID patients are some of the sickest patients they've ever had to deal with. They require much more time. They're in ICUs for 3 times the usual stays. And a lot of them are dying. And I can't even begin to tell you the toll that takes on people. You know, nurses, some of the most empathetic people in the world. And one woman said to me there's only so many bags you can zip up. That's what it's doing to them. It's just crushing them emotionally. And the problem is getting worse. You know, we have already in some states, in Iowa, where I talked to several people, there are no staffed beds left. They are at capacity. And the rise we're seeing in cases, those vertical lines we're seeing on the graphs, that is going to, in 2 weeks' time, descend upon these ICUs that are already stretched to breaking point. Right about Thanksgiving. And then the people who get infected at Thanksgiving are just going to deliver a knockout punch 2 weeks after that.
I want to read from your article. During the earlier surges, hospitals canceled elective surgeries and pulled in doctors from outpatient clinics. People with heart problems, cancers, strokes, and other diseases found it harder to get medical help, and some sat on their illnesses for fear of contracting COVID-19 at the hospital. Now, healthcare workers are facing an influx of unusually sick people at a time when COVID-19 has consumed their attention and their facilities. We're still catching up on all of that, says Chu, the Oregon physician. Even the simplest patients aren't simple. And this has been something we've been dealing with. If you've got cancer, you've got heart disease, or you've got diabetes, for 9 months you've been saying, all right, well, hopefully this is going to get better and I'll have a chance to go in and get the treatment I need. But every one of those beds that's full, it's not a bed. You know, we talk about hospital beds, but it's staffing. A hospital bed can exist unless you have people to staff it. There are people going without treatment. So there are people who will never get COVID, who may not get treatment and may die because we are up to capacity in our healthcare systems.
Yeah, that's absolutely right. It's not just the people with COVID. The entire health system crumbles when healthcare workers, when doctors and nurses are too tired, too overwhelmed, too stressed to just do the business of taking care of patients. And there's one thing that's very different about this third surge and the previous ones. In the previous ones, COVID-19, this pandemic was confined to the Northeast and then the South. So doctors could call in for reinforcements. The cavalry could come. Now, the entire country is on fire, as you saw from the maps. So many places, almost every state, is seeing rises in cases, people in hospitals. There's no help coming. There's no place to draw reinforcements from. And so doctors are stuck. They're seeing what is on the horizon. They're already overwhelmed, and they know what is going to come, and it's not good. Like, there is some hope. There is a Biden administration on the way. There is a vaccine on the way. But that's not going to arrive until the next year. And so the choices we make now collectively in the next days and weeks, we will decide how many Americans are still alive next year to get a vaccine and how many healthcare workers are destroyed in the process.
And you pointed out that the gatherings from Thanksgiving will result in more of this stuff. So please, everybody, it's been so long since so many people have seen their family or their grandparents or their kids. Rethink all your plans. for Thanksgiving. Ed, thanks for your in-depth look into this. Ed Yong is a staff writer at The Atlantic covering science, and thank you for being here tonight, sir.
Thanks for having me.